Hi, Namaste to all. Welcome to Hum Tum discussion. Today we will see the second type of neurodevelopmental disorders, that is speech and language disorders. So, today our topic of the discussion is developmental speech and language disorders, coded as 6A01 by the ICD-11, and it involves three important characteristics. First is difficulties in understanding speech and language. Second is difficulties in producing speech and language. And third is difficulties in using language in context for the purpose of communication. Developmental speech and language disorder includes the following. First is 6A01.0 developmental speech sound disorder, 6A01.1 developmental speech fluency disorder, 6A01.2 developmental language disorder, 6A01.5 other specified developmental speech or language disorder, 6A01.Z developmental speech or language disorder unspecified. So first we will see what is developmental speech sound disorder. The essential features required for its diagnosis are persistent error of pronunciation. It refers to the overall sounds and rhythm of the spoken language, that is the way in which words are spoken. For example, the word DATA we have to pronounce as a data, not as a data. Second is persistent error of articulation. It refers to the production of individual speech sound. It involves movement of the tongue, lips and other articulatory organ. For example, the alphabet B and V, we have to use different articulatory organ. And next is the persistent error of phonology. That means how sounds function in words and sentences to convey meaning. For example, for the word HONEST, we have to drop the first alphabet, that is H, and we have to speak it as a honest. Next is atypical speech sound error for the language spoken, and it involves unusual substitution, addition, for example, extra sounds added to words, word initial consonant deletion for English speaking children, reversal, for example, pat for tap, sound prolongation, and unusual assimilation, and many more. So it will persist beyond the expected age, and onset of speech sound difficulties occur during the early developmental period, and it results in significant limitation in the ability to communicate due to reduced intelligibility of the speech, and it delays in the execution, production and perception of spoken language may also be exhibit, and it may be associated with the imprecision and inconsistency of oral movement required for the speech, and known as childhood apraxia or dyspraxia of the speech, and it results in difficulties producing sequence of the speech sounds and specific consonants and vowels. Next is the developmental speech fluency disorder. An essential feature of this disorder includes frequent or pervasive disruption of the normal rhythmic flow and rate of speech, and it is characterized by repetition and prolongation in the sounds, syllables, words and phrases. It also involves blocking that include inaudible sound, silent fixation or inability to initiate sounds. Also, it includes word avoidance or substitution. It also persists beyond the expected age, that is 2.5 to 4 years of age, onset during the developmental period, and it results in significant impairment in social communication or in personal, family, social, educational, occupational, and other important area of functioning. Some of the additional clinical features includes cluttering, that means speed tend to be rapid, erratic, and dysrhythmic with breakdown in fluency and clarity, often with deletion or collapsing of syllables and omission of the word ending. It may be accompanied by the physical tension in the speech musculature as well as the body tension and struggle behavior. Secondary mannerism also present, for example, facial grimacing, eye blinking, head movement, arm and leg movement such as leg tapping and fist clenching. It is often accompanied by the anxiety in anticipation of speaking and avoidance of speaking. Next is the developmental language disorder. An essential feature of this to diagnose are persistent deficits in acquisition, understanding, production, or use of language, and that language may be spoken or sign language. So some of the specific component of language skill may be differentially impaired, and it involve first is the phonological awareness. That means the ability to decompose words into constituent sounds and mentally manipulate those sounds. Second is the syntax, morphology, or grammar. That is the ability to use language rules, for example, regarding word ending and how words are combined to form sentences. Third is semantics, the ability to understand, learn, and use language to convey the meaning of words and sentences. Next is narrative or conversational discourse, that means the ability to tell a story or have a conversation. And last but not the least is pragmatics, that means the ability to understand and use language in social context, for example, making inferences, understanding verbal humor, and resolving ambiguous meaning. It also persists beyond the expected age. Onset of language difficulties occur during the developmental period, typically during the early childhood, and it results in the significant limitation in communication with functional impact in daily life at home, school, or work. It often runs in the family, and if regression of language skills once acquired is present, it may not be due to developmental language disorder, it may be due to decline in social and communication behavior, or it may be due to autism spectrum disorder. So absence of single word by 2 years of age and failure to generate simple two-word phrases by 3 years of age are important for diagnosis, and diagnosis from 4 years of age onward tend to yield a more stable symptoms presentation. So I am sharing one question for your practice. Which of the following is not a speech and language disorder? First is developmental speech sound disorder. Second is developmental speech fluency disorder. Third is developmental language disorder. Fourth is none of the above. You have to answer in the comment box, and in the coming Sunday I will update or upload the video regarding all the answers that I have asked in the videos. Thank you.